So Dr. Lewis Hsu has devoted so much time to this. He is a professor of pediatric hematology at the University of Illinois in Chicago, with a career devoted to sickle cell disease. He earned his medical degree and is also PhD Biophysics at the University of Rochester, followed by a pediatric residency at Yale and a fellowship at Children's Hospital of Philadelphia. His clinical and translational research in sickle cell disease has led to over 100 scientific publications, including the landmark STOP study of transfusion to reduce stroke risk. It also deals with pain management of patients. He deals with landmark studies of bone marrow transplantation to cure sickle cell. And he studies and has shared with us the effects of inflammatory vasculopathy due to hemolysis in mouse models. During 25 years in leadership of some of the largest sickle cell programs in the country, he co-authored the Hope and Destiny books for family education on sickle cell. He provides training for community health workers for sickle cell disease and the Sickle Cell Disease Association of America, SCDAA. His experience in applying implementation science includes formal training from the NIH TIDIRC program and sickle cell disease projects funded by NIH for sickle cell in the United States and by the European Union for sickle cell in Africa. He volunteers as Chief Medical Officer at SCDAA since 2020, October 2020, and has been available for pediatric sickle cell case discussions for the National Hospital Liaison Committee since the 1990s. So we thank you so much for your research, and we are so excited to hear your presentation.
Thank you so much for the generous introduction. And thank you for the organizers for inviting me. So this is the title slide. These are my disclosures. I have research in sickle cell, consulting in sickle cell. I'm only going to discuss publicly available information and no specific endorsement of commercial products. I'm just discussing progress. Okay, so here is where I am. I'm sitting in Chicago, and on a good day, Chicago can look like this. On a not so good day, we have to be prepared for any storms and all that. And so some of the disclosures is that although this is talking about caring for sickle cell patients without blood transfusion, you have to be ready for all kinds of stuff. And so sometimes there are storms and sometimes there might be need for blood transfusion, but our goal is to try to avoid the storms. This is my lovely wife and me in snowshoes when it's minus 10 centigrade, something like that. The objectives today were to look at sickle cell disease as an inherited anemia briefly, just refresher for things that I'm sure most everybody knows. Identify the specialist care is helpful for optimal care, and that there are multi-system, multi-organ needs in sickle cell, not just the blood system. And then summarizing how there are new non-transfusion preventive options to reduce the risks of acute anemia and complications in sickle cell. So the classical look at what sickle cell looks like is this kind of picture. This is a photomicrograph that I took under the microscope looking at human blood with sickled forms. You see these elongated pointed cells, as well as the more normal red blood cells. under the microscope. And that is the classical understanding, is that it's all about having sickling. What we have been finding from research more recently is that there's a lot of the blood system affected by sickle cell disease, and that white blood cells, platelets, endothelial cells, the clotting system, inflammatory system signals are all involved in sickle cell pathophysiology. If you want to go look at a website with the computer animation of this, rethinkscd.com has that. It's a very cool animation. I'm not going to try to do that now. I'll probably crash my technology. But if you want to take a look at that sometime in your free time, rethinkscd.com. Again, I'm not endorsing a commercial product here, just showing you something cool. But what I'm going to show you is the low-tech version of this. And so let's see if I can expand my head here. So in sickle cell disease, you can also think about the red blood cells with this kind of little model that you have smooth, round, flexible, whereas a sickle red blood cell will be more like this, elongated, pointy, maybe a little bit more stiff, and slightly breaking apart at the ends because of the polymer, the stiff sickle cell hemoglobin making a polymer inside and making this distorted. You can also think about this shape as being kind of like a banana. Now, what does this shape do? Well, one of the things is, if you consider this to be like a blood vessel, this is a pretend blood vessel. I'm in pediatrics, so I do a lot of toys and visual aids. We'll pretend that this is a blood vessel whose job it is to deliver the red blood cell from one end to the other. And to deliver oxygen successfully would be a high-achieving blood vessel. So do you think that this red blood cell will get through the blood vessel? Right? So it can do it with maybe a little bit of pressure, but it slides through pretty easily and successfully got all the way through the blood vessel. However, my sickle red blood cell, pretending with this banana, is going to have a harder time navigating that blood vessel. And kind of, sometimes it can get kind of stuck, and sometimes it makes it through. But there's now additional understanding that with the sickle red blood cells, sometimes it's not just the shape, but sometimes it's also vasoconstriction, that you have tight blood vessel. And so it has no longer the ability, the big lumen that it did. And so that helps to make things get stuck. And so this is blocking the blood vessel, making it not be able to pass through. And so the oxygen is not being delivered and you have a blood vessel that's blocked. This is one part of the pathophysiology, it's just a rigid blockage. Another part, however, is now emerging that there's stickiness, there's adhesion to the red blood cell, shown here as if you put sticky tape on the outside of my smooth red blood cell. And now when it's trying to go through the imaginary blood vessel, it's getting stuck, not because of the shape, but because of the stickiness. And I can drive it through with some difficulty. In fact, I can't even get this guy through until some of the adhesive molecules are stripped off. And even then, it's still not getting all the way through. I'm having a really hard time. So I might have to vasodilate this blood vessel even bigger in order to expand it and be able to get the blood cell through. And then finally, another part of the sickle cell pathophysiology that's being described is that it's not just the shape, but it's also the breakage of red blood cells. So shown here are some dried peppers. People in Nigeria, I know, eat a lot of peppers. Chinese people eat peppers too. These are broken, dried peppers. And so you can see when they break, they release their contents, the pepper seeds, exciting, spicy when you eat them, but also kind of irritating and kind of painful if you have too much of it. Same idea with hemolysis and the red blood cells. If you break a lot of red blood cells, sickle red blood cells or others, when you release the hemoglobin, that is going to set off damage, inflammation, irritation, oxidant stress. And so hemolysis, these broken red cells, is part of the pathophysiology too. And the sickle cell is a hemolytic anemia. So how having hemolysis is part of the condition, but how intense the hemolysis is could be related to maybe how dry this guy is. So if you hydrate the cells better, it may not break as often, or you may be able to have other ways to avoid the hemolysis, reduce the free hemoglobin and inflammation. So those are some of the things shown a little bit in that high-tech video, but that was with some like vegetable examples. Again, because I'm in pediatrics, I just goof around with stuff like that. Sickle cell disease is a global issue where the distribution of sickle cell across the world, sickle gene and sickle cell disease, shown here with the more intense colors, having more individuals with sickle cell disease. So you can see, although there is some in the United States and in Europe, the vast majority of people with sickle cell disease are in sub-Saharan Africa, in India. And so there's global needs for sickle cell care, sickle cell treatments, and sickle cell expertise. In the United States, it's considered a rare disease. Just 1 out of 365 newborns, Black Americans will have sickle cell disease, but in other places, it could be much, much more common, 1 or 2%, in some countries, even 2-3%. So that every classroom would have somebody with sickle cell disease. Every neighborhood, every street might have somebody with sickle cell disease. Hallmark of sickle cell disease is this severe acute pain, shown here by an artist, Hertz Nazaire, who had sickle cell disease and painted this pictures to say, this is what I feel when somebody asks me, what is your pain on a scale of 0 to 10? And I say a 10, this is what 10 feels like, that this is screaming, tears rolling down the face, not able to think about anything else except for the red blood cells. Some of them are red, some of them are blue and deoxygenated and sort of sickled shapes. And then sickle cell disease can affect multiple organ systems, have many symptoms, and need many different specialists. So as we talk about blood transfusion needs and so forth, you might need to be thinking about, will the cardiologist transfuse you? Will the nephrologist transfuse you? The neurologist, as well as the hematologist, because there can be neurologic problems, hematologic problems, bone problems, renal problems, gut problems, gallbladder and kidney, gallbladder and liver and all that. And the organ damage can begin at pretty young ages. So some of the treatments that we're looking at really need to start in pediatrics, even though they may not manifest all the organ issues until adulthood. And until recently, red cell transfusion was the mainstay of treatment for complications of sickle cell. And many individuals with sickle cell received so many transfusions that they developed immune sensitization to the donor antigens. As was mentioned earlier, that having blood that didn't match very well sets off this immune reaction. I remember there was this one patient that our group was taking care of in Atlanta, Georgia, who had so many red cell antibodies that she could not be transfused by anybody in the area. Her only 2 possible donors were 2 people in Scotland. And so if she ever needed a blood transfusion, it was from international request. So as if, really couldn't transfuse her. So this would be some of the things. But what I'm very pleased to report is that there are now these different approved therapies for sickle cell disease. I'm going to try to get my head out of the picture here. 4 approved therapies for sickle cell disease in the United States. In different other regions, maybe not everyone has hit regulatory approval yet. But these are the 4 listed here in sort of an infographic format, made by a talented medical student who is from my university, Illinois, Chicago. And it's listing some of the things that might be relevant as people are looking at which treatment to get. So the 4 columns here, the 4 treatments: hydroxyurea, glutamine, voxelotor, and crizanlizumab. And just to break down the different things here and their properties, some of them are for different ages. So younger children, and then adacvio crizanlizumab for age 16 and up. Some of them could be taken while pregnant, the glutamine here in the second column. Hydroxyurea is contraindicated while pregnant, and then the voxelotor, crizanlizumab have not particularly been tested for pregnancy, so we can't say. They have different levels of side effects shown here. Some mention of how these medicines are given, so that for the hydroxyurea, for the glutamine, for the voxelotor, these are oral medicines. For the crizanlizumab, it's an IV infusion. And then how will it help? Well, so 3 out of the 4 of them have been shown in clinical trials to decrease pain frequency and also decrease acute chest syndrome for the hydroxyurea and for the glutamine. The crizanlizumab has not particularly been shown to decrease acute chest syndrome. And then the voxelotor, its efficacy is mostly shown in how much it can increase hemoglobin, decreasing hemolysis. And then these medicines can be combined. So hydroxyurea can be given alone, shown with this smiley face here. And that's usually our first line of treatment. But it could be combined, hydroxyurea plus glutamine, hydroxyurea plus voxelotor, hydroxyurea plus crizanlizumab, because they have different mechanisms of action. And so what the hydroxyurea can do is increase the fetal hemoglobin to decrease the polymerization, so less of these rigid rods being formed inside of sickle polymer. It also can make the red blood cells bigger, better hydrated, and decrease some of the hemolysis. What the glutamine does is works against the oxidant stress part of the sickle cell disease. So it helps to keep the red blood cell more in the round shape because it's healthier, less oxidant stress inside. Also fights some of the inflammation and oxidant damage shown with the dried chili peppers and the release of pepper seeds. The voxelotor really is designed to work against the hemolysis, and so it helps reduce the hemolysis. The breakdown of red cells is much slower by binding to hemoglobin and blocking that polymerization also. And then the crizanlizumab has a different mechanism where it's trying to reduce the stickiness, trying to not have as much adhesion molecules interacting between the red blood cell surface and the surface, the endothelial surface of the blood vessel. And so the crizanlizumab is trying to really attack the adhesion mechanism, not so much the shape changes or the oxidant stress. So you can see that there's these different mechanisms now of these 4 different approved therapies for sickle cell disease. And these, glutamine, voxelotor, crizanlizumab just got approved in the last 5 years. The hydroxyurea has been around longer, since about 1998. But the latest formulations that makes it possible for young children to take this has been also just in the last few years. So these are fairly new advances, and we're still trying to get the word out with information like this graphic. And then just to emphasize a little bit more about the details of this. So hydroxyurea can make sickle cell disease course milder. Unfortunately, it does not cure, but makes things milder. Can reduce pain episodes by about half as frequent and not as intense. Reduce hospitalizations by about half. Raising the hemoglobin. Less priapism problems, sickling in the penis. Increasing lifespan has been shown by some data. Fewer absences from school or work is definitely at play. We've had some people say, because of hydroxyurea, I was able to finish my master's degree. I was able to keep my job and not get fired because I was having less absences now. maintaining IQ is starting to be shown with hydroxyurea. And then because it is long past its patent, in most cases, the hydroxyurea can be manufactured in other places and has been implemented in Africa and in India. Hydroxyurea for the indication of stroke prevention has been extensively tested. So shown here is a meta-analysis by the group shown at the bottom of the screen, Hassan et al. And they showed that with hydroxyurea, it could help to prevent silent stroke, so that having hydroxyurea could be used as an alternative for transfusion for the purpose of silent stroke prevention. Next medicine to mention here is glutamine. So L-glutamine comes manufactured as a, as a powder packet shown here, where one would open 1 or 2 or 3 of these powder packets in the morning, 1, 2, or 3 in the afternoon, depends on the size of the individual. And then this is trying to alleviate oxidant stress, works through the NADH, NADPH type of pathways, reduces pain frequency, markedly reduces acute chest syndrome, and it's basically a food supplement, but is highly purified to pharmaceutical grade, so we can do it by prescription. The voxelotor, as I mentioned, blocks sickling, reduces hemolysis, can raise hemoglobin by 1 gram, sometimes more. So that I've had some individuals on voxelotor who used to run with their sickle cell disease and hemolysis, their baseline hemoglobin was 8.5 grams per deciliter. With the voxelotor, they were up around 10, 11. Much better endurance, less fatigue, much less jaundice in the eyes too, because the hemolysis was reduced, not down to 0, but much less. And then crizanlizumab, brand name Adakveo, blocks the adhesion, blocks that stickiness. So this is given as an IV infusion. It's trying to block specifically selectin molecules. And given about once a month, it keeps coating the selectin molecules so they don't interact with the red blood, between the blood cell and the blood vessel wall, so you don't have the stickiness hanging up your blood flow. And this reduces pain frequency. This has been successful for quite a few patients. The ones that I've been treating, I usually have combined this with hydroxyurea. And it has the convenience factor, sort of, that you don't have to remember to take it each day. You just have to come in to the clinic for a once-a-month infusion. So some people like that because they don't want to take a once-a-day medicine. Other people find that to be a big barrier that they have to come into the clinic. I'll just briefly touch on some other alternatives that have been explored. One is artificial oxygen carriers that I believe have been discussed elsewhere during this conference. I can't say they're really great for sickle cell disease, however, because they're short-lived. And the anemia of sickle cell disease, the hemolysis of sickle cell disease is chronic. It's not just for a few hours or days, it's going to keep on going. So although these can be used in sickle cell, it would be really, really with the idea that it's a temporary bridge for a day or a couple days. And some people have used these on a compassionate use basis for sickle cell emergencies or get through something. I want to mention this medication, eculizumab, is an antibody type of treatment that blocks the hemolysis due to complement. So if you have the complement fixation to the red cell surface as a reason for increased hemolysis, this can be just magically wonderful in blocking that hemolysis. Doesn't fix your sickle cell problems, but there are some people where there's this phenomenon in sickle cell called bystander hemolytic crisis, where the hemolysis accelerates because of complement fixation on top of the usual sickle polymer type of hemolysis. And so you have even more red cell destruction, even more release of broken red cells. But giving the eculizumab has been able to just like halt it, and has made tremendous difference in some people not having to have a transfusion because they could get this eculizumab. It's a manufactured antibody. For the anemia of chronic renal failure in sickle cell disease or pre-op preparation, sometimes erythropoiesis stimulating agents, ESAs, so that would be erythropoietin, darbepoetin, et cetera, can be given to raise the hemoglobin level so that you make a little bit more red cells than you're destroying, but you still have to be careful to not push the hematocrit above 30 because of hyperviscosity issues. And then just to blow through many different options, when one is dealing with a multi-organ condition, there are actually many, many other non-transfusion therapies that can help a person with sickle cell disease. Antibiotics, vaccinations, fluids. These are all not transfusions, but they can help keep a person out of acute problems. Analgesics, respiratory treatments can all be used in different acute situations or to keep somebody out of the hospital. And then you have more preventive things that are not even medicines: physical therapy, behavioral health, nutrition, school accommodations or work accommodations. We've had some patients where the trigger for their sickle cell pain and hospitalizations was cold exposure. And this one girl was very pleased that she found work as a cashier, but it was inside a supermarket in Chicago where the cashiers are kind of close to the door. And every time the door would open, the winter wind would blow in and all the cashiers were just freezing. So that every time she was on at work for one shift, she would get really, really cold and often end up in the hospital. One accommodation would be to switch her from cashier to somewhere elsewhere in the store. The other would be to switch her to a different structure of a cashier setup where the cashier was not so close to the door, like up the stairs around the corner a little bit. That's what she eventually did, and she was able to avoid many, many hospitalizations that way. Some social support can be helpful, complementary and alternative medicine, I'm not going to get into, but there are people who look at those. I think at the same time, I should espouse the idea of complementary medicine so that you take advantage of the things that are FDA approved or otherwise regulatory approved, and not just have the sense that it's either Western medicine or whatever else you're doing. Try to take advantage of both. There are sickle cell centers trying to do even more research. So there's still more medicines in the pipeline of research trying to test them. And there are many watchdog agencies and regulatory requirements and a whole team trying to support the individual on the clinical trial. So here's a picture. It's a center, this young man, teenager, who was participating in a clinical trial. And as he was doing that, all of his data was being looked at by my institution, by a data safety monitoring board, by the Food and Drug Administration, by the Sickle Cell Disease Association of America, as well as by his local team. So this was me when I had more hair, research nurses, father, and then we had, the whole room set up and everything. So that around each individual who's participating in a clinical trial, there's a whole support system. And finally, I'll just mention that there are now more and more online resources for sickle cell guidelines to walk you through all these different opportunities, different complications. American Society of Hematology, ASH, has a website and an app called ASH Pocket Guide that puts expert guidelines in your hand or in your cell phone, ASH Pocket Guides. The American College of Emergency Physicians, ACEP, has a website called Point of Care Tools that includes one of the tools is for sickle cell care in the emergency department setting. Other things in this point of care tools are like acute stroke, snake bite, poisoning, so that for the emergency department physician who's very, very busy may not have time to look up every single thing or find every single app. This consolidates things in one place, and it has evidence-based guidelines, very, very recent, just in the past 2 years. The Society of Hospital Medicine has also got guidelines and online modules, also developed 2021. People were busy during the pandemic putting stuff like this up. This is for an in the hospital patient. They've already gone past the emergency department. And I'll slightly toot my own horn here. So with several students, we wrote a recent paper that just got published last month, Managing Sickle Cell Disease in Patients for Whom Blood Transfusion is Not an Option, highly similar to this talk. So our objectives were to talk about caring for sickle cell patients without blood transfusion, that this is something that's worldwide, and by reducing the storms of acute illness, trying to prevent things from getting to be so bad that you get hospitalized, you might avoid transfusion. But it probably will take having some specialist care, probably taking some non-transfusion preventive medicines, or being very, very, very diligent about behavioral choices, accommodations at school and work. And I'll leave this one up for the last slide in case people want links to some of the things that I mentioned, and also put in a plug for Sickle Cell Disease Association America's website and One SCD Voice, which is a platform that has more information yet about sickle cell.